Do you look in the mirror now and see the effects of aging? And is that starting to affect how you feel about yourself and even your confidence around your appearance? Have you noticed volume loss that starts to make you look perhaps tired, run down and gaunt, and even in some cases looking really ill, like you might be suffering from some horrible illness? Are you noticing the sagging in the face? So you've lost the jawline, you're getting the jowls and the nasolabial folds. Everything seems to be coming down, affecting the shape of your face, and you've completely lost that jawline. Are you thinking about having some treatment or perhaps some filler treatment, but you're really worried about what you're going to look like afterwards because you see all those celebrities out there and people out there looking really unnatural because they've had some fillers done and they're perhaps looking like they're completely done? Well, at Skin Excellence Clinics, I can reassure you that is not the case. All of our patients have treatments. They leave looking really natural. They're looking just a better version of themselves. And repeatedly we're told, and as you can see in many of our reviews, people just feel so much better, much more confidence, and they walk around with a new spring in their step from having these treatments.
What is meant by full face rejuvenation with fillers?
So at Skin Excellence Clinics, certainly myself, I have many, many years of experience, over 15 years of experience using fillers. And we've got to a point really where we treat the whole face now. And this is well recognized within the cosmetic industry and termed full face rejuvenation using fillers. We're looking at the whole face, and to get a really natural result, we want to treat all of the areas for that patient which need treatment. And we're talking about restoring perhaps volume loss, which can be due to the aging of the bony skeleton beneath the face. It could be volume loss in the fat pads, especially the cheek areas. We may be treating the temples because of volume loss in the temples, across the mid-face from some volume loss, maybe the under eyes from the tear trough area. Often there is a lot of volume loss in the jawline from the bony loss along the mandible, and we might be treating volume loss beneath the skin, perhaps in the marionette area and across the cheeks. And we're also looking to restore support to the tissues to help with laxity. So the ligaments that are holding everything, that are key points where they attach to the bones, we're putting some volume in those places as ligaments to give us support to the tissues. So when we're talking full face rejuvenation, we're addressing all of these areas, all of these aging changes, and all of these areas that need treatment. And we're looking to give a really natural looking result. So at the end of it, you leave really looking at a slightly more rejuvenated, younger version, a better version, the person you were, not the person you've never been. So really, we have the skills and we have the tools at Skin Excellence Clinics to give that to our patients.
What options do I have with fillers for full face rejuvenation?
So at Skin Excellence Clinics, we have two main options when we're doing full face rejuvenation with fillers. We can use the hyaluronic acid fillers, and I always use the highest quality of hyaluronic acid fillers. And this is the mainstay for most people having fillers are using hyaluronic acid. I use brands from Teoxane, Teosil, or Miley, which are the modern generation of hyaluronic acid fillers. So these are fillers that are relatively long lasting, so at least 1 year, if not up to 2 years. They're very well taken by the tissues. There's very little reactivity. So by that we mean very little rejection by the tissue or inflammation associated with the filler treatment, so a very quick recovery. The alternative is to use a collagen-stimulating filler. This is something that I've been perfected over a decade or more, and do a lot of lecturing and work teaching other doctors, specifically using a collagen-stimulating filler called Elance, or ELLANSE. And Elance is a filler that actually will stimulate the natural production of collagen around it, and that makes it a really long-lasting filler, so 2 to 3 years with a sustainable result. But not only that, it not only gives us the effect of a filler, but it also has a knock-on effect of improving the skin and the skin quality above where the filler is. So that's a product that in my clinic is very well respected, and one that many of my patients have benefited from over the years.
Why see Dr. Strawford for this treatment?
So I think it's very important when you're having a filler treatment, certainly if you're having a full face rejuvenation treatment, to see a very, very experienced medical professional. There are many people out there that will just do or have very limited training or skills or ability, who may just place a small amount of filler, say in the cheeks or some limited areas. That's not full face rejuvenation. They're scared, or they're afraid, or they don't have the skills to place filler anywhere in the face safely. And when we're doing full face rejuvenation, as I've said, we need to consider placement of that filler where it's needed to give a really natural and safe result. And that's really, that takes many, many years of skills and experience and knowledge, not only with the use of the product, but also with anatomy and with the aging and understanding of the aging process. And also, seeing a professional like myself who can manage any complication, because thankfully complications from fillers are incredibly rare. We're talking lumps, bumps, nodules, inflammation, and the like, even a vascular occlusion, blocked artery, or whatever. We need to be able to deal with these complications. And we have the ability, the skills, and the setup to deal with any complication that arises from such treatment.
What other treatments may help with full face rejuvenation?
So full face rejuvenation may be the primary treatment that a lot of our patients are seeking to reverse the effects of aging. But we're often combining that with botulinum toxin or Botox to reduce the muscle activity and help lines and wrinkles, or to help elevate the eyebrows, for example. Or in the neck to stop the pulling down of the skin in the neck. We may even be using other skin rejuvenative treatments such as Morpheus8 or Tixel or polynucleotides to further improve the skin and rejuvenate the skin itself. We may even be doing a thread lift to further address laxity and to give a really wow effect from this treatment. So we're often combining treatments. But a lot of our patients, the commonest treatment for having with full face rejuvenation is perhaps regular Botox, and maybe some skin care and some skin treatments to maintain the health of the skin.
How long do the results last?
So the results are quite long lasting when we do a full face rejuvenation. If we're using a simple hyaluronic acid filler, then I normally expect the results to last between 1 and 2 years before further treatment may be needed. If we're using a collagen-stimulating filler, such as a Lancet, then it's 2 to 3 years before we may be looking at further treatment. So in that respect, these treatments should be seen as quite long-lasting.